Hello, everybody. Welcome. This is Finding Your Village Parenting During a Pandemic. This event is being brought to you from a collaboration between World Affairs Council Pittsburgh and PublicSource. My name is Jordan Hicks. I'm the community correspondent with PublicSource. And please help me in acknowledging and thanking our panelists for this conversation that we'll be having. We have Kara Simonillo, who is the executive director of Trying Together. We have Andreas Weber, who is a program manager with the Swiss Agency for Development and Cooperation. And we also have Daniel Alexander, an interdisciplinary artist and a marketing and communications coordinator with a learning exchange nonprofit. And so before we start, I just want to take a minute to just like acknowledge everyone and look everyone in the eyes and acknowledge everyone's humanness. Thank you for joining us. We don't take it lightly that you are choosing to spend your time on being a part of this conversation. So outside of the conversation that we'll be having, the most important thing is your comfort. If you feel the need to get up and stretch during this conversation, do that. Get a glass of water, walk away from the computer, turn this into a podcast situation and only listen to the audio. Come back to the conversation if you need to leave. Do whatever you need to do so that you are in a position where you can receive the information that we'll be discussing today. So I think everyone is familiar with this proverb, but there's a proverb that's an African proverb that says it takes a village to raise a child. And that means that there's an entire community of people who must interact with children and for those children for them to experience growth in a safe and healthy environment. Safe and healthy environment probably directly contradicts everything that involves COVID-19. And still, um, you all are participants and all of our panelists have an opportunity to put that village to use in a virtual way and still hold firm to their commitment to their children while also balancing work responsibilities. And so what we want to center today is the perspectives of fathers, and we have two of our fathers here who are going to share their experiences with us and how they're multi layered and multifaceted, so that hopefully through COVID 19, once we get to the other side of it, we can be a better community for our children. So, the first question I would like to pose to Andreas and Daniel is, how has COVID directly impacted your role or how you see your role as a father in your children's lives? So probably maybe Daniel, you could go first and then Andres.
Um, I think that's a great question. Before COVID, we were in a situation that our daughter Malu, um, she just she had turned 1, and my wife and I had plans that because of the pregnancy and because of healthcare, I decided to keep working, and then she would stay at home until finding the right time to go back to work. And going right back to work, it was I think a little bit before, or actually it kind of like coincided with COVID-19. And so for we were super lucky that my mother-in-law got at home. She traveled from Brazil to the U.S. to Pittsburgh to be with us, and then the pandemic started. But what I saw, like just with the working remote, um, it was nice to be at home with the entire family. But at the same time, it wasn't because I would just keep working in a room for the entire time, and then I would just like not travel. I would cross through the living room where all the family would be, and I would see one moment from my whole family there, but then I couldn't engage with them. And I think it affected me in a way that I was just like, oh, I am here, but at the same time, I'm not here. And I know that at least in the first, I think maybe in 2 months, I was struggling with this feeling of being at home, but at the same time, not being at home because I was working the entire time. How do you feel about that, Andreas?
Well, for me, it's difficult to answer this question because I only know being a father during a pandemic, because our son Mateo, he was born on the 24th of March, which was one day before in Colombia the quarantine started, because our son was born in Colombia. I was working back then for United Nations in Colombia. And we had planned to return to Switzerland in June. But of course, then the pandemic came and everything changed. So I think it definitely impacted the way I'm fathering, but I cannot compare how it would be without a pandemic. I think for us, the biggest challenge, and for me personally, was just to being alone. So our son was born. It was supposed that my mother-in-law would join us, and she couldn't travel because the airports closed just some days before she was planning to travel. So in the end, after the day after our son was born, we returned to our home and we were just alone. And of course, then we were trying to build this village to connect virtually with our families, with our friends. But it's definitely not the same connecting virtually after such an important event like having a baby.
So keeping with this thing of connection, Daniel, you're saying that you were with your family and with your daughter, but you weren't feeling connected with them because you were having to work and you had to prioritize your day. That's what I'm hearing you saying. And then Andres, I hear you saying that you only know being a parent during quarantine, and so your whole experience from birth, from before birth to birth, really was impacted by the virus and everything. So, Kara, I'm wondering, how has the virus impacted the way that you connect with, say, the people who make policy, and connect with the people who offer the resources in the state, in the city, in our region in terms of early childhood education? How has the coronavirus, COVID-19, impacted your connection with these different kind of wheelhouses that make early education work in our region?
Yeah, that's a great question, Jordan. So, interestingly, in some ways, it's been easier to connect with legislators. And in part because often when we meet with legislators, they are on the move. They're going from Pittsburgh to Harrisburg, Harrisburg to Pittsburgh. They have limited time in district, or they're going physically between meetings, right? Different meeting locations. And with COVID, they're not. They're sitting in their home and they are legislating from home. And so, in some ways, it's been a little bit easier with their schedules to be able to connect with them. The way that we've been connecting is all virtually. So, we've hosted legislative roundtables, we've hosted visits with early learning programs, with childcare providers, and with parents. And we're doing it all through the computer. And in some ways, it's just been a little bit easier to get to our legislators because we're not fighting against the travel schedule that they've had. So that has been one, I don't even know if we'd call it a silver lining, but one positive that's come from it.
There was an article published in the Atlantic a few months ago that talked about how now that the issue of the infrastructure almost of childcare is in the forefront of politicians' minds and policymakers' minds and in government's mind, that hopefully this kind of male dominated government that we have will start to be more open and considerate to how we fund childcare, because childcare is infrastructure. It gets us to where we need to get, just like roads and buses and bridges. It's a connector. If you don't have childcare, then it makes it even more difficult to work to support your family and to take care of your responsibilities. What are you hoping this time, Kara? And this is really open to everyone, but specifically, Kara, what do you hope this time will inspire in our policymakers in our government that will positively affect the support that we have in our region for early childhood education?
Yeah. I was on a couple calls this morning, or a couple meetings this morning, and I said that the struggle that I think we're still faced with is that we don't tend to center children in our community. We don't tend to center families in our decision making. And my hope from this pandemic experience is that if you can't quite get the importance of children thriving and the long-term impact of that, of them growing into healthy, vibrant adults, if we don't quite get that and value that, I think the pandemic has helped some of our policymakers understand that child care is core to economic recovery. So they can sort of see the value of caregiving through the lens of the economy. And while I wish we would just center and value children, they're our most vulnerable population out there. If we can't do that, then I guess if we can still center children and look at it from an economic perspective, then that's a place to start. And maybe that'll be the sort of conversation opener to help our policymakers truly understand why children and healthy child development matters. So I am hopeful that'll come out of this.
Andres or Daniel, did you have anything to add to that? It's okay if you don't.
I think just from the mental health perspective, when we have children at home, and especially like toddlers or like newborns, I can't say much about newborns, but with toddlers, it was interesting for us to see that with the arrival of the pandemic, we were in a situation that it was me, my wife, my mother-in-law, and also Malu, our daughter. And it was like the first 2 months, it was fabulous because we were together. We were just having like this family moment. And maybe my wife did, I didn't, but I did not realize how the pandemic was affecting her mental health until one day she was and she was out front with my wife and also with my mother-in-law. I was in the living room working, but then my wife told me what happened. They were playing out front, just like in a regular day, probably spring day. And then the mailman came, and our daughter, she freaked out because she saw another human being whom she hadn't any contact for several weeks. And that was like the moment that we saw that, oh, she's being affected by the pandemic, by this whole situation, just being at home with us and not seeing any other children. And before that, she was going to daycare like almost every day. And after that, we saw like, okay, I think the moment that we can get her back to the daycare, like even with the pandemic, like of course we have to be very careful with all of the measures and with her safety. But we saw a lot of when the economy started to like open up, like the daycare started to open up again. We saw a lot of parents debating like whether it was the right time to send their children back. And I remember that I was a little bit concerned with her health and also with our financial situation. And then my wife was the one who like, oh, I think we should send her back because it's going to be good for her. And then after like having conversations, we decided, okay, let's send her back. And it was the best decision and the right decision for her mental health, because we saw the first 2 days that she was still looking around and seeing like, what is this environment? I was at my home for 3 months. And then after 2 days, we just saw her just like happy and natural and just like engaging with all of the other children around. And that was a good thing especially for me to see like how daycares are so important for children. Like it is a safe environment for them to play and engage with each other, but also for their mental health.
Kara, I see you affirming.
Yeah, I mean, I'm thrilled, Daniel, hearing it from a parent. I think just like we as adults crave interactions and relationships, so do children. And not that Malou, who I love that name, Malou wasn't getting that from her family. She absolutely was. But certainly children learn from each other. So being in communion or being in relationship with their peers is fundamental to the way in which children learn. Learning is a social construction. It's a social process. And just like us, when we all sort of had to quarantine and we weren't able to be out and about, I certainly know that, there were days where it was harder than other days, where you get a little bit sort of sad and depressed, and you wish to be out and about like you used to be. It's the same for children. They just don't have maybe the communication capacity to explain it verbally, but it's showing maybe in other ways, like Daniel described. So he described it wonderfully, and it just sort of exemplifies why it's so important that children have those early learning experiences.
Andres, when we spoke preparing for our interview today, you mentioned that for the first few days, your baby wasn't even able to see your face because you had to wear a mask the entire time. And so I'm wondering now that, so once again, Andreas is in Switzerland and they have seen a rise in cases again. So they're kind of on the second wave of the coronavirus and he is working from home. But I'm wondering, how has your baby been developing and growing into their self at home with their parents during the pandemic?
Well, I had to wear a mask, but fortunately not for the first few days when he was born, but when we traveled back. So we had a long trip back, and all during this trip we had to wear the mask. And it was very interesting to see because when we were wearing the mask, we noticed that actually he was very confused. So because I think communication with a newborn is much more difficult than with a toddler, and we were both like a bit concerned and also impressed to see how he reacted to see us with mask, and he couldn't read our faces. So this was definitely, we felt quite bad, but at the same time we knew we couldn't take off the mask because there were very clear instructions to wear the mask during all the flight. So this was definitely a moment when we noticed actually this, just your facial expression is very important to communicate with a newborn. And also I think we felt that the first 2 weeks we spent almost all time at home, and we didn't meet anyone with the exception of the pediatrician. So there we were also wondering, like, what will be the impact on our baby? Of course, in the first few months, it's not, probably it's less important than later on. But now we're very glad, like being back here, life is also now I think authorities know to manage a bit better the pandemic. They're a bit more, they know what works and what less, and they allow more activities to take place. We started now daycare, and I think you really see this, that it's good for now he's 6 months, and it's very good to have these interactions. And you really already now see that he's enjoying it. So I think it's definitely good that we return to some level of normality at least.
Thank you. I also recall something that we spoke about previously was, of course, you are here with your child and your partner, and you're concerned about the health and safety of your family, but you also have family who are outside of the country that you're located. And so I'm wondering, from like a mental health standpoint, how was it keeping tabs on checking in with any of your parents or your elders who weren't in the countries that you are located?
Probably I can start here because I think this was definitely something very challenging, because on the one side, like having a baby is something very new, and you're also a bit insecure because you want to do the best for your baby, and then I think it's even more important to have this opportunity to share with your peers, with your family. And some things you can do virtually, but other things it's just not the same if you are present, if you can feel them, if you can if they can just give you advice and everything. And in our case, I think also the pandemic, it was a challenge because it was at the very beginning. My wife's family, they live in Ecuador, and Ecuador, Guayaquil was hit very hard. and there were some cases of COVID in her family. So I think this definitely affected. So it was an additional stress factor. So you're stressed because you have a baby and you want to make sure everything, and you don't have any kind of support. But then you have also you're worried about your families, and this just mentally, I think it was a big challenge. And then in addition to this, you're not allowed to leave your house, so you're within your four walls 24/7. Which I think it's definitely not the situation that you expected. Of course, there are also positive sides. We spend more time together, but I think overall, it's the challenging parts were a lot.
Yeah, so our families, both our families live in Brazil. We're from Brazil, and before the pandemic, we had just returned from Brazil for, unfortunately, my father-in-law passed away in January. And then we returned to Pittsburgh. Luckily, we could welcome my mother-in-law, and she just came and the pandemic started, but still, we had a lot of concerns and anxieties involving our family, and especially because we have relatives spread out in the country, and when we saw COVID arriving in Brazil, it started in Southeast, and then we have family there, and then it went to different parts of the country. So again, it was just concerns and anxieties because it was affecting the country so hard and on different levels. But I remember one situation in which my parents, they live in my hometown in the north of Brazil, and like same size of Pittsburgh. The city is called Santarém. And one day I saw that, okay, now Santarém, a lot of people in Santarém has COVID-19, and they live in a building. And then the people living in the building started being infected by COVID-19. And the first reaction that you have when you have your family abroad is just like, okay, I just need to be ready to do anything, like leaving your house and going to the airport in case anything happens. And I saw that, oh, like my parents are at risk, and I might have to travel to Brazil. And I went to see the flight tickets, like just one flight ticket with a one-way trip from Pittsburgh to Santarém, Brazil. It was over $5,000, and it's usually just $1,000 round trip. And that time, like that moment, I realized that it would be impossible for me to leave the US and then travel to Brazil in case anything happens. And we saw that happening not only with family, but also with people studying in the US, and just like they would have to leave the country, but they couldn't. And then after that, we saw the borders just like shutting down. And then, okay, now it's going to be impossible to travel to Brazil. But hopefully nothing happened. We just remain in our space, and just like in touch with our family all the time, and trying to calm them down, and they trying to calm us down at home.
I'm wondering, were you all in connection with any of your friends or family members who are also fathers? And what did you feel like you were having similar experiences, or were you not really sharing what you were experiencing and what you were going through? I guess more or less my question is like, did you have a male centered like support system of fathers to give you advice? Andreas is a new father. Daniel also is a kind of new father. That was helpful, that provided any insight or guidance or support?
Well, I had my friends, some of them were awaiting a baby. And of course, this was very good to exchange with them. And I think in our case, it was very helpful. My sister, she's a midwife, and this was just excellent to have her and to contact her at every hour of the day, text her, and she could give us all the support that we didn't have because of the pandemic. So this was a very precious But of course, this was more the medical advice. And then I think it was even for those who didn't have baby, I think it was challenging for all of them. And it was good to have this, to keep these challenges, even if this channel open to exchange with your peers and friends, and just to have an open ear that listens to you.
Yeah, I didn't have a network which I could open up. I think I had one friend, maybe one or two friends who were parents, like fathers, and we would exchange one message or maybe two messages a week, but it wasn't the kind of thing that I was like always sharing experiences and looking for advice. And then on the other side, my wife, she had this huge and strong network of moms, and they just like sharing experiences all the time. And they were on Marco Polo, just sharing experiences as well, doing a lot of like good things for each other.
Kara, so the reason I asked that question is because typically childcare, babies, early childhood education, from an American standpoint, is usually seen as something that women are more aligned with, that women do, that is like women's kind of realm. And so I wanted to hear if, from a male-centered perspective, if you had anything that you could share in that vein. But Kara, I'm wondering from you, have you seen ways that gender roles show up in maybe how money is spent or how we think about money when it comes to how we support and pay for teachers, early childhood education, programs, all of that, just everything that really involves that world of educating young kids?
Yeah, I think there is a generational shift happening, you know, and certainly I don't want to paint a broad brush, but it's noticeable when you visit with legislators who grew up in a different time period where their wife stayed home, cared for children, and maybe they didn't even utilize childcare. And then I was on one of my earlier calls today, this actual topic came up. I had a caucus meeting with a number of legislators, all of whom happened to be male, and they were probably all under the age of 40. And they all could speak from firsthand experience about child rearing, child care, what kind of child care they were using, their relationship with their child care provider, the things that they and their family and their wife were struggling with. And it was very much a shared responsibility. I could hear it in the language that they used. I could hear it in the way that they described their experiences. And I think in part it's because, the younger generation of parents, either it's because they need all available parents working because they need both incomes, or because both parents want to work and they both gain from having a career, something that's theirs that they can put their professional energy into, and that's valued and respected. It's not just a value of a male perspective, but it's also a value of women. So I definitely see a difference. I see a difference in the way it's childcare and child rearing is discussed, and the way it's prioritized. It's the intimacy for which they know their child. That's different. I think that's changing as well. And it's wonderful because I think the more we can get everyone sort of collectively acknowledging the value of it and carrying the load, the more we'll prioritize that as an important part of a person's lifetime. And so I think it is definitely shifting.
So we have a question from one of our attendees, and that question is, how do you and your partner balance home and work responsibilities, avoiding the tendency of one overtaking the other, how do you compartmentalize, or can you? I'm going to read that one more time. How do you and your partner balance work and home responsibilities? So let's actually just deal with that question first, and then we'll go to the second one. How do you and your partner balance work and home responsibilities? So whoever would like to go first.
It is difficult. In our case, my wife was taking care of our daughter. I would say all the time because I was working, and I remember that the first 2 months of the pandemic, I was struggling with this feeling of being at home and at the same time not being at home, and especially because we were under pressure at work because of the pandemic. And then I started to become more involved with taking care of Malu at home. But at the end of the day, because of the pandemic, because of the whole situation of working remotely, I was more working, and then my wife, and also my mother-in-law were more concerned with Malu. Not that I wasn't concerned with her. And then going back to the daycare situation, she finally could go back to daycare, and we saw that my wife had more time to just study. She's now doing her master's, so she could study and also do other things that she wanted to do other than taking care of Malu.
Yeah, I think this question also from our side, I think we are dealing with it every day, because it's I think the situation changed so quickly, and you have to find a new balance, or try to find a new balance, because I still think we are still struggling with it. At the very beginning, I had 4 weeks of paternity leave, which was very good. So I think at the beginning we were both trying to handle a household and make everything possible for our baby. But at the same time, I think also as a father, there are some things that you can't take over. So you cannot breastfeed your baby, so you can sleep at night a bit more than your wife, and that's an advantage. But at the same time, it's also sometimes challenging, because you want to support your wife and there is not much you can do. At the beginning, so I took over a lot of the work at home, to cook, to keep the apartment at least in a state that we felt both comfortable. Now back in Switzerland, I think it changed. I had to return to office, which was also challenging for my wife, because she has her own startup, and when you're your own boss, then it's difficult to turn off your brain and not think of work, and at the same time having a baby. So now this month we started with daycare, and we both hope that this will again help us a bit to find a new balance, to have at least some days where my wife can also concentrate 100% on her work. And then in the evening, we just try to balance a bit. That one evening she takes care of the baby, like bringing him to bed. The other day I do. So we're trying this, but we have to renegotiate it every few weeks, I feel.
Kara, did you have anything you wanted to add?
So I have children as well. Mine are school-age children, and like you, Daniel, I felt challenged by the fact that I was physically in the house, but I was distracted with work, and have been distracted with work. And Andreas, I relate to you in that I've come to realize that I had to adjust my own expectations. And so it may mean that instead of saying I've got a 6-month plan, I've got a 1-week plan. And I try to sort of control my calendar so that I can be available for an hour in between my younger daughter's sort of virtual transition from one class to another. And I try to make sure she actually eats lunch. But my husband works outside of the home, and he's been considered an essential worker from the beginning. So the load has been on me to do both my full-time work and work from, and the support of my children, or our children. So I think just taking it day by day or week by week is sort of the way that I've kept my mental health. And when my husband gets home at night, he tries to jump in and take the rest of the load off for the rest of the night. And, we just try and work in partnership to the extent that we can. So I can definitely relate to, I think, a lot of families out there that are just figuring it out as they go.
Yeah, I'm wondering, now that school is in full swing, so you have that added to the list of things that that parents and households are juggling. For trying together, what has been the most present issue that you all have been tackling during COVID?
I think from the very beginning, mid-March until now, the theme that has been through it all, the thread sort of through this past 8 months, has been the unknown, the lack of being able to control what's going to happen and what each day is going to bring. So that unknown piece of their work. So for folks that don't know, we support the childcare sector here in Southwest Pennsylvania. And, a portion of our sector remained open when we went to the red phase so that essential workers could get to work. And then slowly, as the state allowed for more and more reopenings, childcare has reopened more and more. But I think the anxiety that our providers have felt was really about how do they make sure that they are creating the safest environment for children, while also balancing that with their own staff and their staff's needs, who also come with families and their own health concerns and their own anxiety around it. So, we're 8 months in, and I think some of it has sort of leveled off in terms of like, okay, we know a little bit more about this virus. We know a little bit more about what helps to mitigate it. So I think that's helped to bring about some level of security. Security is not the right word, but level of, control. But I think the question that still remains is, families, not all families are comfortable sending their children back to childcare. What will it mean for the long-term impact on the business of childcare? Childcare is a sector that has a really thin margin in terms of its sort of revenue. And we know that we can't pass the costs on fully to families. And so, I think sort of the long-term financial impact of childcare is the yet to be known. And I think it's that just not knowingness from the very beginning to now that has really been the challenge for providers.
Yeah, that's interesting. So we're hearing from the provider standpoint, not being certain when and how the money is going to come through to support their business, but also from the parent standpoint, do we have the capacity financially to pay for care, to put our child in the best facility possible? Daniel, I remember when we spoke, you said that it was important that your daughter was in a facility that also had a important look on culture and celebrating different cultures. How's that been going?
Yeah, we're still in the same daycare, and for us, we see results coming like slowly, and by the way, I think the daycare managed the whole situation in a very neat way. Like, since from the beginning of the pandemic, they gave us options to, like, we know that families are struggling right now, but they need daycare. So they were like always talking to us and checking on our financials, and so this month, just like offering us possibilities. And that was one of the reasons that we decided to remain with them. And it really matters for us to expose Malu to different cultures. she goes to a daycare where they spoke multiple languages. I think it's Spanish, French, Italian, and also English, and now Portuguese. And we saw that Malu is now coming back from the daycare. Sometimes she just like speaking different words, and that's very rewarding for us to see that that happening.
Yeah, I'm sure that's super excited to hear your child coming and speaking French one day and then Italian the next. I don't even do that. So right now I want to open it up to our audience to suggest any questions or ask any questions that they have. Thank you for sticking with us for as long as you have. We're going to wait for those to populate in the chat. But also I wanted to follow up with Daniel, with you about Malu. You said that, you know, she was having a hard time dealing with strangers or people she didn't recognize coming to the house. But also I'm going to ask all of you this question. How have you navigated choosing who to expose your child to? Because I mean, family doesn't stop you from passing on the coronavirus, but how are you navigating that?
I think it's an interesting question because we know that we cannot be at home, where we cannot be within our four walls, as Andrea said, 24/7. We need to socialize. We started doing this via Zoom calls with the daycare and also with friends, but it's not the same thing. And we, with the daycare returning, we decided, okay, let's go back to the daycare. And we saw Malu socializing with all of the children there. But then she goes to the daycare only part-time. And we also want to socialize with friends, and they also have children. So we now have bubbles in which we are participating in, but still in the bubbles, we're very careful and being very respectful also with other parents. We see some children playing like regularly, but then we also see that there are some parents that they're not comfortable with having their children playing in a room or outside, like close to each other. And then that's when we go to meetings or to places, and then we just like try as much as possible to limit a space for our child to be, and not be interacting directly with the other child in the room. So we're always balancing this, like respect, and then also how to be sociable in that situation. And also when we're in the room, we're like wearing masks and still like practicing physical distancing. Yeah, that's what we can do at this point.
I very much agree that socializing virtually, and especially with kids, it's not the same. So, and you have to balance this, and I think it's, as everything in life, you have to take certain risks. And what we're trying to do, of course, we see our friends with babies or with kids, but we're trying not to meet like in too big groups. So probably just 2 families or 3 at the same time. And I also feel, at least the information that we got here in Switzerland, is that first of all, babies or kids are not that affected from COVID, and they don't spread it apparently. So the risk for our baby, for Matteo, I think is not that high. But of course, it's also protecting us and then our parents and our friends who are at risk populations. So this is also why we took the decision to still send him to a daycare and to still meet, because I think in the end, we feel it's more important that he can have these social contacts, and that also we can have a certain kind of social contact, of course, taking the preventive measures. I also felt that it's like with waves. So there was one point, like when we arrived to Switzerland, they were lifting the restrictions, and people were also getting a bit more reluctant to stick to the rules. And now we had this recent rise with even more cases than in March. And now it's again, I think people are taking more preventive measures again.
I can also add a cultural component to this conversation of like how to expose children to like to the outside world. So the first we were in Pittsburgh when the pandemic started. 2 or 3 weeks ago, we arrived in Brazil because we decided to be with our family. Like, okay, if we're gonna be isolated, let's just be isolated with our family, and taking advantage that the Brazil borders are now open. But then the situation here in the country seems a little bit like the situation in the US. We have part of the population just like, we're living our lives regularly and I don't have to wear a mask. So we're now going to places and we take Malu with us, but at the same time, we're very careful with her and going to places. We're like wearing masks, but at the same time, when we meet with friends, um, we want to be very respectful with them, but we also know that the Brazilian culture is completely different than the American culture. People like to hug, people like to just be very close to you. And sometimes it's super difficult for even like a family member who you're not seeing for ages. They go to your house and they're like, "Oh, there's Malu," and goes to hug her. And sometimes we have to be like, "Please do not hug her," or just, okay, that person already hugged Malu, so whatever. Like for instance, yesterday we're not in a beach town, and we went to the beach yesterday. But then we went to the beach, but we wanted just to be very far away from people at the beach. We were basically in a empty spot, and just like the four of us there, like my brother-in-law is with us now, and just like isolated from everybody there. And that's how we try to live our lives, like in this new normal.
Tara, what about you? Your children are a little older, but how do you, like, yes, we love to embrace and hug, but no.
Yeah. They're older, so it's easier to explain the why of what we're doing. But they're also at a point in their life where that peer engagement is really, really important. They're less interested in their parents. So for my younger one, similarly, I live on a street where there's a number of children that are her age, and the parents, have sort of, all of us have said, okay, we're not formally, but we're a pod. And so they ride bikes together and ride scooters together and swing together. But they, for the most part, keep their distance. But at least they're in community with each other in some way. My older daughter, who's a teenager, it's funny because teenagers actually like to be sort of hugging and touching and hanging on each other. And they are very much less interested in adults. So I think that's been the bigger challenge, just sort of shifting how much she gets to see them and how to do that. Both of them had birthdays during sort of the height of the pandemic. And so we had to get creative with how they could see their friends and get some version of an interaction, but do it in a safe way. So, we're just figuring it out as we go.
And we have about 5-10 minutes left. So I want to shift it back to the perspective of the parent and all of you. I don't have children, so I'm also like taking these, that was my alarm, taking these and like storing them away for like if I need them, when I need them. Um, how do you, is it hard to prioritize your mental health over maybe what your child needs when they need it? Has that been difficult during the pandemic? If so, how, when?
It is, and I've I think this is the moment of the pandemic in which I'm just experiencing mental health issues, and that was one of the reasons that we decided to be with our family here. But um, first, you're just trying to provide the best to your child and also your partner, and but it is a crazy situation, and everybody, regardless of being a mom or a dad or a frontline worker or anything else. I think everybody's going to go through this because we're like in the month number 8 or 9. I lost track of it, but it affects your mental health in a way that you cannot imagine. You think you're hanging in there, like, okay, I'm doing fine, but then the one day the bubble burst, and you're like, oh, what's happening to me? And if if I had to just give one advice to myself before this pandemic, was to just like being very careful with the mental health situation.
Andres, I see you agreeing, shaking your head in affirmation.
Yes, definitely. I think this is something that it's difficult to predict. Like, or yeah, I wasn't aware that this might be an issue. I was very glad that we could return to Switzerland, and I felt then things became much better, because in Colombia we were really, it was at the beginning of the pandemic. Quarantine was very strong, so we weren't allowed to leave. So it was very difficult to keep this balance. But it was also, and like at the beginning, we were still in this kind of emergency mode. You were functioning, which was also good. And then returning to Switzerland, at least they were lifting measures, so we could meet some people, we could leave our house, we could go for walks outside. So this helped a lot, and I could start to do some sports again outside. So I think this definitely helped. We will have now a second test, because they're again tightening the measures. So we will see how it goes. But I feel at least now I know a bit better how to handle it.
Kara?
Yeah, I would agree. I'm not great at prioritizing myself over my kids or my work. So that's probably a lifelong struggle that I'll continue to have. Um, but I'm very aware that when I am sort of better able to take care of myself, I'm better able to take care of my kids. So I'm very aware of how that's connected. I think, in thinking about the childcare provider community, um, I think that was probably one of their biggest concerns about the pandemic is many childcare providers very much know their families, and they know families, sort of what's happening for families at home prior to COVID. And so when COVID hit, I think a lot of providers grew increasingly nervous or worried about their families. Many childcare providers are an extension of the family. And so they know when times are tough in a home, and the isolation, I think, increased their worry for their families. So, there are folks that we ourselves know we need to be sort of careful about our own mental health. And then I think, the caregiving community around families are very much aware of that. And I think it's also important to remind families that they can reach back out to their caregiving community when they need help, because it's what they're in the business for, and it's why they do what they do. And so not to hesitate to lean on them.
Thank you for that. So I don't see, excuse me, any questions from our attendees. And so I think this feels like a pretty good place to end. I want to ask you, our panelists, one final question before we end. But I just wanted to thank everybody for participating and joining us today. Please share your feedback. My alarm is telling me it's time to wrap up. Please offer us your feedback. Yvonne is going to put a survey in the chat. Please fill it out so we know how we can better improve these events, and that you may get the best out of them, the most out of them. Please follow PublicSource and the Council on social media for upcoming programming. And please save the date for the Council's end of the year gathering, which is going to be redefining global learning on December 1st. Thank you. Fill out the survey. And my last question for our panelists is, with everything that's going on and all the changes and the unpredictability, what is something you are most thankful for and most grateful for that makes up your village of care that you provide for your family and your kids?
I've first of all, I'm thankful for my health and for the fact that I have a roof and I have food. And right now I have a job because I know that I know a lot of people, families who lost relatives or friends. I lost like an indirect friend or relative because of COVID-19. But I know a lot of people who lost their job as well because of the pandemic. So I'm thankful for that because, and of course, I think I'm most importantly, I'm thankful for my health because without health, I cannot provide, I cannot help, I cannot be with my daughter and also with my wife and also with my family.
Yeah, I very much agree. I think it was a tough time for us having a baby during a pandemic, but at the same time, we were still very privileged. I had job security. I think living in Switzerland, you are affected, but not compared to other people in other places of the world. So I think it's always good to be aware that even if it's difficult, there is also you can still be very privileged. And for me, I think one other thing I really notice is just like having a working social network of people who you can count on unconditionally, and they're there to support you. I really felt this during this time, and then this is very precious. And also, I think it's something that you have to appreciate. It's sometimes taken for a given, at least in my case, and I think it's very good to be aware that this is something that you have to appreciate even in times when there is not a crisis.
Yeah, like Daniel and Andreas, I mean, it would be hard for me to complain about much. Um, I think beyond my health and the fact that I do have job security, my husband's had job security, and we have weathered it fine. I'm thankful for the fact that I get to be home with my kids because, quite frankly, they're at the age where they don't care so much about parents, and so now they're sort of forced to hang with us. So that's a silver lining. And then I'm just going to put a shout out for pets. I mean, pets can help you through some hard times. They're the excuse to go outside and take a walk. They're the ones that'll cuddle up for you, and they don't care how you smell or look or any of that stuff. So I'll just add also, the other silver lining is just having my dogs around. So yeah.
Yeah, shout out to the pets. I became a pet parent over the pandemic as well. So shout out to the pets and the pet parents. Thank you everyone for joining us. To Bethany, Alita, Olivia, Sarah, and Thomas in our chat. Thank you so much for participating, as well as our esteemed and respected and gracious participants. Thank you again. Everybody take care of yourselves, choose joy, drink water, wash your hands, and do the best that you can do. It's every day that we have. And I look forward to seeing you next time. Thank you.
Thanks, everyone. Nice.
Thanks, everyone.
Thank you for having us.
Stay healthy.
Right.